In May 2024, a hospital system serving 2 million patients across 8 states filed for bankruptcy. 5 hospitals closed. 2,400 workers were laid off overnight. Entire communities lost their only emergency room. And while nurses were escorted out of buildings they'd worked in for decades, the CEO, Ralph de la Torre, was sailing the Mediterranean on his $40 million yacht. He'd also bought a $15 million fishing boat and a mansion in Dallas. When the United States Senate subpoenaed him to explain how he drained a healthcare system dry, he simply refused to show up. The first person to defy a Senate subpoena since 1981. This is not a story about one bad hospital. This is the story of an invisible machine, quietly buying everything you depend on and bleeding it dry. To understand what happened, you need to understand private equity. Here's the simplest version. A private equity firm finds a company, a hospital, a veterinary chain, a housing complex. They buy it, but not with their own money. They use massive amounts of borrowed debt. Then they do something remarkable. They transfer that debt onto the company they just bought. The company now owes billions it never borrowed. Next, the PE firm pays itself enormous dividends, pulled directly from the company's revenue. They sell off the real estate. They cut staff. They slash quality. And when the company inevitably buckles under the weight of debt it never asked for, the private equity firm has already walked away with hundreds of millions in profit. The company dies, they win. It's not a flaw in the system. It is the system. Let's go back to where it started. In 2010, Cerberus Capital Management, a private equity firm named after the three-headed dog that guards the gates of hell, bought Caritas Christi, a Catholic hospital system in Massachusetts, for roughly $900 million. They rebranded it Steward Health Care and expanded aggressively, growing from 6 hospitals to over 40 properties across 8 states. But that expansion wasn't about serving patients. It was about building something big enough to strip. Over its decade of ownership, Cerberus extracted more than $800 million from Steward. They executed the classic playbook. They sold the hospital real estate to a separate company, Medical Properties Trust, for over $1.2 billion. The hospitals that Steward operated, they no longer owned the buildings. They were now tenants, paying rent on properties they used to own. Hundreds of millions flowed out in dividends. Near the end, Steward paid its owners a $111 million dividend, while hospitals were already struggling to buy basic supplies. CEO Ralph de la Torre made $3.8 million in salary the year before bankruptcy, while companies he personally owned received $250 million in compensation over 4 years. He bought a $40 million super yacht, a $15 million fishing boat, a mansion in Dallas. A whistleblower later told Congress that de la Torre bragged he could sway foreign officials with brown bags of cash. When the Senate Health Committee voted 16-4 to subpoena him, the first Senate subpoena of its kind since 1981, de la Torre called it a pseudo-criminal proceeding and refused to appear. On September 25, 2024, the Senate passed a criminal contempt resolution by unanimous consent. He still didn't show up. Now here's where this story goes from outrageous to terrifying. Steward Health Care is not an exception. It's the template. This same playbook is being run on everything you touch. Your pet gets sick? Mars Incorporated now owns 3,000 veterinary clinics, Banfield, VCA, Blue Pearl. Jab Holding owns another 1,400 through NVA. Together, they've built a near monopoly on animal care. Since 2020, Veterinary prices have jumped 32%. Some acquired clinics report 5 fee increases in a single year, 3 to 6% each time, with no explanation given to staff. Senators Warren and Blumenthal opened a formal investigation in November 2024. Your home. Investors bought 30% of all single-family homes sold in 2024. Blackstone alone controls 230,000 apartment units. In Atlanta, corporate landlords are a leading factor in declining black home ownership. And after the Eaton wildfire destroyed homes in Altadena, California, in January 2025, 47% of post-fire home sales went to LLCs and corporations, not families trying to rebuild, but investors trying to profit from disaster. They're buying your nursing homes too. And your doctor's office. Private equity now touches 40% of physicians' staffing. They roll up small practices, raise prices, and push doctors to see more patients in less time. The pattern is always the same: acquire, consolidate, extract, abandon. Let's talk about what this actually costs in human lives, because this isn't abstract. Researchers at Harvard Medical School analyzed over 1 million emergency department visits at 49 private equity-owned hospitals and compared them to 6 million visits at regular hospitals. What they found should make you furious. Private equity hospitals had 7 additional deaths per 10,000 emergency visits. That's a 13.4% increase in mortality. After acquisition, full-time hospital employees fell 11.6%. Emergency department salaries were slashed 18%. ICU salaries dropped 16%. Fewer staff, lower pay, more death. And Steward wasn't the only case study. Prospect Medical Holdings was bought by Leonard Green and Partners in 2010. They extracted $424 million in dividends and fees. CEO Sam Lee personally took $90 million from a single $457 million dividend. 8 hospitals closed, including Crozer Chester Medical Center, the last Level 1 trauma center in Delaware County, Pennsylvania. Closed May 2025. An entire county lost its highest-level emergency care because a private equity firm needed its dividend. Then there's Envision Health Care. KKR bought it for $9.9 billion in 2018, loading $7 billion in debt onto the company. Envision became notorious for surprise medical billing. When COVID hit and non-emergency visits dropped 70%, the company hemorrhaged over $1 billion. Doctors were pressured to work dangerously short-staffed. In May 2023, Envision filed for bankruptcy. $7 billion in debt, gone. KKR walked away. So let's make this personal, because if you're watching this, private equity has already affected your life. You just didn't know who to blame. Your vet bill went up 32%. That's Mars and JAB consolidating the industry. Your rent keeps climbing even though wages haven't. 1 in 10 American apartments is now owned by private equity. Blackstone raised rents 36% at one property in 4 years, 8 points above the area average. Your ER wait time doubled. That's because the hospital cut 11% of its staff after a PE firm bought it. The monopoly playbook is elegant in its cruelty. Buy all the competitors in a market, eliminate choice, raise prices, cut quality, extract dividends, and if anyone complains, there's nowhere else to go. In cities like Charlotte, Jacksonville, and Atlanta, corporate investors own 18 to 25% of all homes. The places where first-time buyers, disproportionately black families, once built generational wealth, are now rental properties feeding quarterly earnings reports. Eviction rates spike 30% in areas with high institutional ownership. When the Altadena fires displaced families, corporations swooped in to buy the land before the ash had cooled. This isn't capitalism. This is extraction disguised as investment. And it's happening in every zip code in America. But here's what private equity doesn't want you to know. The house of cards is shaking. Since September 2025, PE stocks have cratered. Apollo dropped 41%. Blackstone fell 46%. KKR collapsed 48%. In early 2026, a $265 billion private credit meltdown sent shockwaves through the industry. Blue Owl Capital gated a $1.7 billion fund, meaning investors literally could not withdraw their own money, triggering sector-wide panic. Apollo took a $400 million fraud-related write-down. The SEC fined Blackstone, KKR, and Apollo a combined $63 million for record-keeping failures. The model that killed hospitals, gutted veterinary care, and turned housing into a financial instrument may finally be killing itself. The question is, how much damage will it do on the way down? Next week on The Blind Spot, we expose another invisible system designed to control your life, your credit score. Who invented it? Who profits from it? And why the number that determines whether you get a home, a car, or a job was never designed to be fair. Subscribe so you don't miss it.